President Biden is already more than halfway to his goal of 100 million shots in 100 days. But some groups who need vaccines the most aren't getting access. White people are getting vaccinated at a much faster pace compared to Black people, despite the fact that Black people are nearly 2 times more likely to die from COVID. This is Sarah Owermohle, a healthcare reporter for POLITICO, and here's what you need to know about vaccine demographics. The federal government purchases and distributes the vaccines, but it's the states who give the vaccines to local counties and prioritize who gets them first. The CDC, aka the federal government, recommends who should be in which phase. States generally follow them, but also personalize plans to their needs, like including additional groups in earlier phases than the CDC recommends. Currently, 41 states are reporting on demographic data, and the results are glaring. In New Jersey, Black COVID deaths are 16% of the total, but of those vaccinated, only 5% are Black and 66% are white. There are many reasons for these disparities, but a big one is speed. With Biden's 100 million goal and the advent of variants, a lot of states are prioritizing efficiency over equity. Mass vaccination sites and online appointment systems often leave out minority groups due to a lack of access to transportation and technology, thus serving the people who need them the least. So how does this get fixed? Biden recently pledged 1 million doses per week to minority communities, working with churches and local health centers to increase access. Addressing these disparities is a crucial early test for the Biden administration promise to tackle racial inequity. But again, states are the ones actually implementing this stuff. So Biden made a big promise, but it's not entirely his to keep.